Every year, we take care of our patients day in and day out, and we have a special day dedicated to them. And this year, 17th September, is being designated as the World Patient Safety Day. And each year, the theme of the Patient Safety Day changes. This year's theme is about improving diagnosis for patient safety with the slogan, "Get it right, make it safe." Today, being the World's Patient Safety Day, we will be having two of the eminent people of Nazareth who are the patient safety officer and the clinical safety officer who will be telling you about the World Patient Safety Day.
Today we come together to emphasize the importance of patient safety in healthcare. Let us renew our commitment that is reliable, compassionate and secure to provide healthcare to all our patients. Hi, I am Dr. Rosa Dora India, Senior Medical Officer in the Department of Medicine and Clinical Safety Officer, Nazareth Hospital. What is patient safety? Patient safety are a number of activities which are undertaken by an individual or organizations to prevent healthcare associated harm to healthcare recipients.
World Patient Safety Day is an opportunity to raise public awareness and foster collaboration between patients, health workers, policymakers, and healthcare leaders to improve patient safety.
Today we come together to observe World Patient Safety Day, a day dedicated to emphasizing the critical importance of patient safety in our healthcare systems. Every patient deserves a correct diagnosis to receive the appropriate treatment. Misdiagnosis or delayed diagnosis can have serious, sometimes devastating consequences. Therefore, it's vital for healthcare professionals to employ the best tools, follow the most rigorous protocols, and engage in continuous education to minimize errors. We come to the goals of patient safety. The number one goal is patient identification. This is a very important aspect from the time the patient enters the hospital till the time the patient goes out from the hospital. This is very important because in our day-to-day experience, we have found that there are some patients who have got the same name, even the same title. So to eliminate this risk, we have to be sure to ask the patient's identity very carefully before we set out in our diagnosis, in our examination, and in our prescription of medications. Using the MRN is the most safe way of ensuring identification safety. The second goal is improve effective communication. This is a very important thing from a doctor's perspective. Effective communication from doctor to nurse, doctor to doctor, and doctor to patient. Effective communication between doctor to nurse, doctor to doctor can be done by using the SVAR. That is, using the SVAR as S is for situation, to identify the situation. Third goal is improve the safety of high alert medications. This is important from a doctor's point of view of giving the right drug, the right frequency, the right dose, and the right route. This should be communicated properly, whether in prescription or whether by verbal orders. That is the fourth point, that is correct site of surgery, correct procedure, and correct patient surgery. This is important and it can be done by having checklists in the OT before anesthesia, before skin incision, and before the patient leaves the OT. This is known as sign in, time out, and sign out. These three procedures should be vigilantly ensured that they are
done so as to have a safe surgery. The fifth point is reduce the risk of healthcare associated infections. This cannot be emphasized enough, especially among doctors. We have to be careful that we have to use the 5 moments of hand hygiene before we touch the patient, before any procedure, when we come in contact with patients after a procedure, and after touching the patient's surroundings. The second point is hand washing, using the steps of hand washing. Sixth point is reducing the risk of patient fall. This sounds like it is not up to the doctor, but it is very much up to us. When we are on our ward rounds and when we are around, we should be alert, especially with old patients, that they are not left alone without the side railings, because many times patient attendant, they go to the washroom, they go here and there, and they forget and they leave the patient without side rails, especially in old patients with and restless patients. Because of their sickness, they might fall off the bed.
So let's reaffirm our commitment to these principles. Let's make every effort to get it right and ensure that our practices make it safe for every patient we encounter. Thank you for being a vital part of this mission and for working towards a safer, more effective healthcare system for all. I thank all our healthcare staff who are working with us for the safety of our patients. Happy World Patient Safety Day.